is the licensed acupuncturist and herbalist. This is my assistant Rani, and also my editor for all my articles. And she wrote very beautifully, so I'm very lucky to have her. Today we're gonna talk about sciatica pain and shoulder pain. So I had that pain the first time when I was, I think 35 years old, when I have long flight, go back to China to carry my older son to China. So I was sitting there for 13 hours. So my muscle already very tight. And then after that, I went to sleep with a Benadryl. So I slept for like 6-7 hours without moving. So when I get up, I was limping. And that's the first time I didn't even know it's a sciatica pain, because I can literally not using my right leg. And after that, my sciatica pain comes and goes. And for sciatica pain, there is a very interesting thing. It's always on one side. So did you ever have one?
Yes, I do.
Yeah. So when you have the pain, it's usually around like your one side. And do you know what triggered that? Driving for long distance or sitting?
It's actually not moving for a long time. You're right. Maybe sitting for a long time, slouching on the couch, not moving around, and sometimes you can't figure out what triggers it. But it is usually on one side.
Yes, and so the piriform muscle is very deep in the buttock, and if we sit for too long or standing for too long, then the muscle gets so tight, and then it's going to the spasm state, and then it pressed sciatic nerve. Usually when you only have muscle tension, and then your nerves are not swollen, then it's not shooting down. But if the muscle tension lasts for a longer time, then you're gonna have shooting pain. And if you still didn't pay attention, then that nerves will get inflamed, and then you will have burning pain first.
Correct. And then last longer.
Yes, not only last longer, and eventually some people can develop a dropping foot, meaning their foot cannot. Yes. So last time you had one, and is it shooting or it just localized?
It started with one side on my left side. Sort of the top of my buttocks, and then it started going down all the way in the back to my heel.
Yes. Oh, so it is shooting.
It did shoot.
Yeah. But then last time when I treated you, you said when you move around, it's better.
It was much better. It felt like the muscle was less inflamed. It released that pain in the muscle.
Yes. So typically, when it's just muscle issue, you can move around. And the worst pain happens when you stay in one position and you try to move. You try to change the position. So what I will do, I have different treatment strategy. One is that if you can lie down like last time, and then I put needles there, and I will using the needle stretch the muscle fiber. And when you get up, the pain will be reduced, and then you walk around, and the muscle will be balanced.
Absolutely.
Yeah. But if the muscle spasm to the point that it pull the joint out of alignment, then walking become very difficult. Yeah. So last time I had that is 2 months ago. After I kind of was lifting things, and then the muscle get tight, and then I slept for longer hours, and the next day I was standing there to treat patient for more than 5 hours, and then the joint out of alignment. So what I do is another treatment method. So I put needles not in locally, because the muscles are so tight. If I put locally, the pain will get worse. So I put in the remote area like hand, and once I put it there, the muscle is not so tight. So I'll use the cane. That's how bad it is. I use the cane and I walk around, with the needles. So if I don't have the needle in my hand, my muscle will get tighter when I walk, because the gravity will put the pressure on the muscle. And that way I walked for half an hour like an 80 years old lady, and finally the joint is realigned. Yeah, so the pain is getting better. So last time I only treat you like 1 or 2 times.
Correct.
Yeah, and then it
And
went
I found
away.
results almost right away.
Yes, so
within 15 minutes I was walking with no pain.
Yes, that's the muscle, because you have strong muscle and you don't take a painkiller, and then you're pretty healthy. It's just like the long time sitting, standing, or the reclining chair is the worst.
That's what I noticed when I tried to sit out in the sun for a little bit.
Yeah.
And I think it's the reclining chair, because arching my back that way,
yes,
right away causes that pain.
Yes, that's exactly right. Because you recline this position, so you didn't use your muscle to hold the spine. Instead, you relax your muscle, you put all the pressure on your spine.
Right.
And that can also cause, if the sciatic pain is not relieved as soon as possible, the spine will be pulling one side, and then the disc will be bulging. And if it's long enough, it will be herniated there, and that will be very bad pain.
Right.
Thank you very much.
You're very welcome. Thank you, Dr. Lee.
Thank you.